Okay, Michelle, thank you. You're our Director of Nursing, RN. And so what is the difference between, for example, a patient that's on quarantine, a patient that's on observation, or a patient that's positive for COVID? And how do we, as healthcare professionals, handle this?
Sure. So first I'll start with the ABC, patient ABC. So patient A has been diagnosed. A has the coronavirus. B is anybody that's been around them, okay? So it's like, okay, this person was diagnosed. I mean, this might be a wife or a child or a loved one that has seen them within the last 14 days.
Within 6 feet?
Yes,
and without a
yes,
mask.
they have close contact. So patient A has it. Patient B has been near patient A, okay? Patient A has it. They are quarantined until their symptoms resolve plus 72 hours, okay? Patient B is going to self-quarantine for 14 days. The reason patient B quarantines for 14 days is they say that people can be non-symptomatic for 14 days before showing symptoms, okay? So what they call that, the incubation period can be up to 14 days. So they want to make sure, they say 14 days, no symptoms, you're clear. So A quarantines, they have it. B has been near A. They quarantine for 14 days and they're waiting to see if they get symptoms or if they don't have it. A patient C is someone that's been around a patient B. So they've been around somebody that's been around somebody. So patient C doesn't need to quarantine at all. So now when we talk about observation, so right now we don't have anybody here that has the coronavirus, okay? The only way it's gonna get in here is if it's brought in here by an employee or a patient that comes from the outside. So what we do is, you know, they talk this 14-day quarantine for patient B. The 14 days is a good number. So if anybody comes from outside the facility, what we want to do is just keep them by themselves and observe them for 14 days. So just like everybody else, we're checking their temperature, we're looking for symptoms. So the observation doesn't mean they've had it, it's just they might have had the opportunity to be around somebody that might have it. So we just, to be safe, want to watch that patient for 14 days before we intermingle. Does that make sense?
And if anyone has questions, even if first of all, there's no such thing as a dumb question. I mean, I did a dumb thing. I read the paper and I thought it was like do gown, goggles. And then because of that, because I didn't have time to read it quickly, this lady that was working last night freaked out and it was the whole thing. So there's no such thing as a dumb question. And also just realize, like, if you have a question, probably 10 other people that are thinking the same thing, but they just don't think to ask it. So it's good to ask questions, because then sometimes we ask a question and they're like, you know what, that's a good question. Let's try to, you know, do we know? Let's try to find out.
Know the answer immediately to where we need to research, you know. But I mean,